And here is your question. Right. So if you have read and understood, considering it history taking station, kindly begin.
Yes, ma'am. Good morning.
Good morning,
My-
doctor.
Myself, Dr. Jatin. I'm one of the surgical trainees. May I confirm your name and age, please?
I'm Janet, 36-year-old.
Okay, nice to meet you. So, what brings you here in the hospital?
Yes, I came to hospital because I've been having difficulty with my breathing, and I'm also sweating a lot recently.
I'm so sorry to hear about this.
Thank you.
Can I ask you some further questions regarding
Yes, go
this
ahead.
problem?
Yes.
So, for how long you are experiencing these symptoms?
About a month now.
Okay. So, do you feel breathless all the times, or it comes and goes away?
Mm, most times it's there, but not that. At times it will become more, at times it will be little, but it's there. It's present.
Okay. So, is there anything which makes it worse, like when you lie flat?
No, nothing makes it worse. Nothing makes it reduce.
Okay. So, can you climb a flight of stairs in a one go?
Yes, I can, but I may become a bit scared while climbing because of my difficulty with breathing, but I can climb it.
Okay. So, do you wake up in the middle of the night gasping for air? Have you noticed such thing?
No, I don't have that, doctor.
Okay. So, has it started suddenly or gradually?
Yeah, it started gradually. I think after I got home, after the doctor told me they had to remove my gallbladder, that was when I started noticing the difficulty with breathing.
Okay. I understand. So you're experiencing difficulty in breathing for last 1 month, along with this sweating, right? And it is
Yes.
intermittent in nature, right?
Yes, doctor.
Okay. Have you experienced any episodes of cough, fever, or wheezy chest?
No, I don't have that.
Okay. Have you experienced that you feel your own heartbeat?
No, I don't.
Okay. So have you noticed any unintentional weight loss and loss of appetite recently?
No.
Okay. So can you tell me how much you can how much distance you can walk before breathlessness stops you?
Okay, I can walk up to 5 poles without the breathlessness stopping me, except I want to stop. It doesn't stop me from walking.
That's good. So have you met GP in the past for any other medical illnesses?
No, apart from when I was having the tummy pain, I said I should come to hospital to see a surgeon. I'm not seeing GP for any other thing.
Okay. So are you taking any medicines?
No, not at all.
Okay. Are you allergic to any medicines?
No, I don't have any allergy.
Have you undergone any surgery in the past?
No, no, doctor.
Can I ask you some personal questions?
Yes, go ahead.
What is your occupation?
Yes, I'm a bar attendant.
Okay. With whom do you live at home?
Yeah, my husband and my 2-year-old boy.
Okay. So do you take alcohol or do you smoke?
I used to take alcohol, but I don't smoke. I don't smoke.
Okay. How many how many units per week?
It's maybe averagely maybe 10 units per week. I don't think I
Okay.
take much of that.
Okay. So is there anyone in the family having similar complaints?
No, no.
Okay. So do you have any idea what you're suffering from?
About my
About this shortness of breath? Do you have any idea?
I think it's because of the surgery that they said I'm going to have. I'm just scared because of that. I think that's what is causing it. That I want to be doctors to be sure that that's what is causing it. There's no other problem.
Okay. So is this the thing for which you are most concerned about?
Yes, I want to breathe better. So I want to breathe very well and not be scared again also. So I'm concerned about it and then also concerned about the surgery as well.
Okay, I really understand. I'll be there to help you and support you. And don't worry, you are in good and safe hands. Okay. So our consultant is the best surgeon over here.
Okay.
We'll really take good care of you.
Okay, that'll be good.
Okay. So I would like to ask you some more questions.
Okay.
Have you ever suffered from headache, dizziness, or seizures?
No.
Have you had any problem with your waterworks?
Can you summarize your history taking now, please?
Thank you so much. So, a 36-year-old female presented to me with the chief complaints of the shortness of breath and sweating, which she is experiencing from last 1 month. It is intermittent in nature. And there is no history of any cough, fever, and wheezy chest. There is no constitutional sign symptoms. This shortness of breath is associated with the anxiety, as she is going to have a surgery after 6 weeks. And she also told me that her GP did investigations. So my top differential will be the anxiety, shortness of breath related to the anxiety. I will also like to rule out any cardiac problems or any respiratory illnesses, cardiac problems like angina or and respiratory like pneumonia.
Okay. What investigations would you ask for?
First of all, I will try to contact the GP of this patient and will get hold of the previous investigations, and I would like to see those investigations, and then I would get a fresh investigations and 2D echo, and also involve a cardiologist to get a review from him, and I will reassure the patient that I'll be there to help her and support her during and after surgery, and also I will advise her to involve a family member or a friend which will provide him or her which will provide her support during and after the surgery, mental and physical support.
Okay, since this patient is on list for elective laparoscopic cholecystectomy, do you think patient's surgery should go ahead?
First of all, I would like to rule out any organic cause like cardiac or respiratory cause for this shortness of breath. If the cause will not be there, then we can go for the surgery.
Right, thank you. Now, my one little question. Why did you ask for echo and not simple ECG and ABGs?
Yes, ma'am. I forgot.
So always simple investigations first. Chest X-ray, you can say ECG, you can say ABGs, you can say, because this will rule out your any chest condition or MI or anything that you suspect as a secondary or
Okay, ma'am.
chest X-ray for pulmonary embolism, chest infection, any secondary differential diagnosis that you have, and then you can, okay, if something comes and you suspect that, okay, it is MI, then you can go for echo.
Okay, ma'am.
Good, thank you.